السلام عليكم ورحمة الله وبركاته. I am Dr. Fatma Atiyya, Head of Pharmacovigilance Department. First, I would like to thank for invitation to participate in Mansoura International Training Department in World International Day of First Aid. Today we will speak about first aid of drug allergy. First, we would like to focus about pharmacovigilance and can divide it into two words. First, pharmaco, which mean medicine. Vigilance, which mean to watch, alert watchfulness. Our lecture today about drug allergy and when we use a drug to treat something wrong, like use penicillin or other related antibiotic to treat infection, use antiepileptic to treat epilepsy, chemotherapy in cancer patient, insulin in type 1 diabetes mellitus, product containing iodine when some patient wanted to make a CT brain or MRI or other like that, sulfa drug in some infection, aspirin or ibuprofen or other non-steroidal anti-inflammatory as analgesic or pain management. In certain situation, the solution become the problem. What? Yes, as I said, the solution or the drug becomes the problem, the pain problem, which may be fatal or life-threatening. It can be defined as an immune response in the body that produces an allergic reaction to medicine. When I take a medicine, my immune system defined it as a harmful thing and starting to fight it by releasing inflammatory mediators and inflammatory chemicals which fight it and responsible for allergic symptoms. According to allergic symptoms can classified into non-serious or serious, which is known to be anaphylaxis. First, we will talk about non-serious symptoms like lacrimation, runny nose, sneezing, edema, redness, itching, cough, rash. So, it can treat it. Stopping the offending agent, withdrawal the drug, treating current symptoms. We can use antihistamines like Avil ampoule. We can use corticosteroids like Silocortif ampoule or dexamethasone. Now we will talk about serious one or anaphylaxis. It is the most severe type of allergic reaction and should always be treated as a medical emergency. Requires immediate treatment with an adrenaline auto-injector which is injected into the outer mid-thigh muscle. Unfortunately, this is pre-filled syringe of adrenaline auto-injector not available nowadays in Mansoura. Maybe later on be available. So we talk about it and explain how to use it as it is life-saving. If the treatment with adrenaline is delayed, this can result in fatal anaphylaxis. We can summarize symptoms in swallowing of throat and tongue, difficulty of breathing or breathing very fast, difficulty swallowing, tightness in your throat or hoarse voice, wheezing, coughing, noisy breathing, feeling tired or confused, cold skin that feels to the touch, blue, gray or pale skin, lips or tongue, palm of hand or soles of feet. Our first aid is lay person flat. Don't allow them to stand or walk, as in the picture. If unconscious or pregnant, place in recovery position on left side if pregnant. If breathing is difficult, allow them to sit with leg outstretched, as we see in the picture. Hold young children flat, not upright, also as we see in the picture. If person carrying an epinephrine or adrenaline auto-injector, be well good and time-saving. Use it immediately. If there is vomiting or bleeding from mouth, turn a person to the side to prevent choking. If there are no signs of breathing, coughing, or movement, begin CPR, cardiopulmonary resuscitation. Do an uninterrupted chest breath about 100 every minute until paramedics arrive. Immediately call 123 ambulatory number. Loosen tight clothing and cover the person with blanket. Don't give the person anything to drink. Monitoring in hospital for around from 2 to 12 hours until the patient or until the person hemodynamically stable. This is the adrenaline auto-injector. As we see it pre-filled syringe ready to inject. We open the tip and inject it in the outer mid-thigh. Anaphylaxis treatment if adrenaline auto-injector is not available in hospital immediately or fast as possible. We give adrenaline intramuscular in anterolateral aspect في الميدل third of thigh with dose of 0.3 to 0.5 milligram, may repeat it every 5 to 50 minutes or IV infusion. We will need to oxygen supply. We will need to fluids given by drip in vein by use cannula. As we all know, prophylaxis is better than treatment. So we will speak about prophylaxis of allergy. First, for antibiotics or drugs may be suspected to cause allergy, we make skin sensitivity test. Also, we teach patient or patient education to wear medical alert if he known to be allergy of some drug, to make allergy history to be facilitated to treatment by other people or other healthcare providers. Also, we can use patient safety during injection with use clean workspace, hand hygiene, sterile safety engineering syringe, sterile medication vial and diluent, disinfectant skin, appropriate sharp disposable, appropriate waste management. Finally, all thanks to all healthcare providers to treat the side effect of many drugs and to reporting this ADR, adverse drug reaction, and reporting us about this. We will happy to contact us in our WhatsApp, Facebook page or Telegram channel. This is the reference of our lecture. Thank you for all, and we will happy to ask any question if you left it in the comments. We will be happy to answer it. Thank you.